Depression is a mood disorder that comes under the broad classification of depressive disorders. It's a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. The common understanding of depression as an illness is characterized by sadness, but the symptoms of depression can vary from mild to severe and can include depressed mood most of the day. The affected person may feel sad, empty, and hopeless. The depressed one may not be necessarily aware of it. Loss of interest or pleasure in almost all activities is another symptom. The activities or hobbies that were once enjoyable might seem boring and empty. Changes in appetite can be a symptom. There may be a lack of appetite or craving for certain food items. These will subsequently result in weight gain or weight loss. Sleep is a factor that is affected. There can be insomnia or hypersomnia. The affected person may have lack of sleep or disturbed sleep. On the contrary, it can also be sleeping too much, but the person might still feel tired and sick. Fatigue or loss of energy is also a symptom of depression. The affected person feels too drained to engage in activities. There can also be noticeable increase in purposeless physical activities such as inability to sit still, pacing, hand-wringing, or being slowed down. Feelings of worthlessness or excessive and inappropriate guilt might be present. These feelings may be purely delusional many a times. Diminished ability to think is another symptom. There can also be difficulty in concentration. Another sign of depression is the recurring thoughts of death. Suicidal ideation with a specific plan, without a specific plan, or a suicidal attempt are counted as the symptoms of depression. Symptoms must last over a specific span of time and must represent a change in the previous level of functioning for a diagnosis of depression. There can be times when one is sad due to the death of a loved one, loss of a friend or job, business setbacks, etc. It's quite normal to have feelings of sadness during these events, and those undergoing these situations might say that they are depressed. It is important to understand that being sad is not identical with having depression. It is normal to grieve, and both grief and depression encompass sadness and withdrawal from the usual activities, but they are strikingly different. Grief comes down over time. Depression persists and gets worse. Time doesn't heal depression. Another point is that of self-esteem. Grief has no impacts on self-esteem usually, but depression adversely affects it. Serious thoughts of death is absent in grief, other than exceptions of the imagination of joining the departed one in the afterlife. It is necessary to differentiate grief from depression to get proper help and support. Depression can affect anyone. Even if you live in relatively ideal circumstances, there are possibilities of depression. Genetics is a notable risk factor for depression. If one identical twin has depression, chances are high up to 70% that the other will have the disorder at some point in life. Personality plays a significant role. People who are pessimistic easily succumb to stress and anxiety, and people with low self-esteem are more prone to depression. Environmental factors for depression are traumatic experiences, continuous exposure to violence, abuse, being rejected, poverty, etc. These can create more vulnerability. Fortunately, depression is one of the most treatable mental illnesses. The chances of recovery are relatively very high. Medication is an efficient treatment for depression. Antidepressants might be prescribed to modify the affected person's brain chemistry. It is advised to take medications only under the guidance of a registered medical practitioner. There are several courses of medications, and it is up to the psychiatrist to opt the best for the individual cases. Psychotherapy is one of the most efficient means of dealing with the depression. It is proved to be effective in the case of mild depression by itself, and for moderate and severe cases it is coupled with medications. There are several therapies employed in the treatment. Cognitive behavioral therapy is the commonly used one. Cognitive behavioral therapy is defined as psychotherapy that combines cognitive therapy with behavior therapy. By identifying faulty or maladaptive patterns of thinking, emotional response, or behavior and substituting them with desirable patterns of thinking, emotional response, or behavior. ECT or electroconvulsive therapy is a medical treatment reserved for patients with severe depression who have little improvement from the other treatments. Electroconvulsive therapy is a procedure performed under general anesthesia. In this therapy, small electric currents are made pass through the brain, intentionally triggering a brief seizure. ECT causes changes in brain chemistry that may quickly reverse symptoms of depression. There are also certain things that people can do to cope with the symptoms of depression. Regular physical exercises is an important thing to do. It creates a positive feeling and improves the mood. Getting enough exercise for the body is a good way to stay healthy physically and mentally. Sleep is another factor of importance. Enough quality of sleep on a regular basis is a highly desirable practice. It has numerous benefits and it helps in coping with depression. The recommended amount of sleep for a healthy adult is at least 7 hours, and most people don't need more than 8 hours of sleep. Eating a healthy diet is essential for being healthy. Proper diet is a very efficient coping strategy for depression. Avoiding alcohol and other substance uses are also very significant in dealing with depression.